Welcome back! In this video, we will talk about the outcomes or impact of shared decision making. So, you might already have guessed that the shared decision making process does not always happen in everyday practice. This is why teams around the world create interventions to help health professionals and patients participate in shared decision making. Examples of such interventions include patient decision aids, decision coaching, and training to educate health professionals. How do we know if an intervention to promote shared decision making actually works? To answer that question, our OMERACT team is working with patients, clinicians, and researchers to select core outcome domains. These domains are outcomes that should always be assessed in trials. They are at the center of the OMERACT onion. Let's take the example of a clinical trial that is testing the patient decision aid used by Mary and Dr. Joint. Based on interviews and surveys of patients, clinicians, and researchers in rheumatology, here are 6 questions we could ask to assess if using this decision aid during our consultation worked to support shared decision making. Number 1. Does Mary know about the treatment options? Does she know each drug's potential benefits and risks, and understand the probabilities of these benefits and risks? We need to measure if the decision aid changes Mary's knowledge of her options. Number 2. Does the decision to select drug A instead of drug B align or match with Mary's values and preferences? We need to measure if the decision aid helped Mary and Dr. Joint choose the treatment that has the characteristics that matter most to her. Number 3. Is Mary confident with the chosen option? Does she feel that she and Dr. Joint made the best decision? Number 4. Is Mary satisfied about the way they made this decision and about her level of involvement? Number 5. Is Mary adherent to the chosen option? We must measure if Mary followed through with the chosen treatment option and started using drug A. Finally, number 6. Do Mary and Dr. Joint perceive any potential negative consequences of using the decision aid? For example, do they feel it was difficult to use, stressful, or took too much time or money? So there you have it, our currently proposed 6 core outcome domains. 1. Knowledge of all available options, their potential benefits and risks. 2. Choice of an option aligned with the patient's values and preferences. 3. Confidence in the chosen option. 4. Satisfaction with the decision-making process. 5. Adherence to the chosen option. And 6. Negative consequences. Keep in mind that, in addition to these outcomes specific to shared decision-making interventions, it is also important to measure health outcomes like joint inflammation, pain, fatigue, and side effects, which are recommended by OMERACT for the different types of arthritis. Other outcomes may also be important to assess in clinical trials, but we still have to do more research on them to decide. Finally, we focused on Mary's outcomes, but since shared decision-making happens in collaboration with Dr. Joint, we are also interested in these outcomes from Dr. Joint's perspective. In summary, these outcome domains will help identify which interventions are the most effective and safe to support shared decision-making for use in clinical trials. Now, please complete our survey to help us agree on core outcome domains. Thank you for helping us improve outcomes of shared decision-making interventions in rheumatology.